She was a pretty girl, was my dental hygienist, and I told her, you know, you're a very pretty girl, and she, of course, loved it. And then I said, but you can be prettier. And she just went, how could I be prettier? And so I showed her. So this is about people that have teeth taken out for orthodontics, and the majority of the time it's not necessary, and it affects how their face looks for their whole life. So I call it 4 on the floor. The dangers of 4 bicuspid extraction orthodontics. Sometimes it's necessary, and I agree that it is, but in a very small percentage of cases. I have an agreement with my orthodontists that treat my patients. If you can treat the patients without taking out 4 teeth, please do so. And that's all I do. And most of the time they don't, because it caves in the faces, makes the nose look longer, thins the lips, constricts the dental arches, and reduces room for the tongue. And then the last statement is a dental statement that the front teeth get too close together. Instead of looking like this, they look like this. They're held together, which you'll see. And it often leads to jaw problems and bruxism. Now, this is how I evaluate patients that have had 4 teeth out. If you look at that gal, and I put gauze inside her lips, and it pushes the lips out so that you can see. So if you look at her on the left and look on the right, she looks totally different with the gauze inside her lips. And that's how she would look if they didn't take out 4 teeth. And if you look at her profile, you can see her chin looks longer, her chin looks longer, her nose looks bigger, but when you put the gauze in, it's gone. And this is a look at lips with the gauze inside of there. And there's the actual way she is, and that's with gauze in there. And that's the same nose, but it looks different because the orthodontics pulled her teeth back and made her lips thinner and made her nose look longer. And this is my beauty queen. She's a lovely, lovely girl, hygienist. And I put the gauze in there to show her how she looks. And look at her lips. It's totally different. Now, look at her profile. Look at her chin, her nose. Now look at that.
Bring us some of that gauze.
You have to leave it in all the time.
Oh, okay.
This shows, and this is what I'm talking about when the teeth are pulled back and held together. And her bite is terrible. To look at her back teeth, it's a sin for a dental hygienist. So this is dental, and she accepted retreatment. She's one of the thriftiest person I ever knew, but when I told her she would look prettier, she jumped on it. And see, she has nice shape, form, and function, you know, and that's how she looked on the right there. See, that's the same girl. Now she's pretty here, and she's beautiful here. It's an amazing change by giving her new orthodontics that brought her teeth forward where they should have been. And we were going to put extra teeth in, but her teeth moved forward. All of her teeth moved forward, and so the orthodontist did a magnificent job. And it's totally different, totally different. So this 25, 30 years ago, I was studying with these very wise men that taught me about occlusion and everything. And now I teach that same course. But they said they're taking out the teeth that's not right. And the orthodontic schools are all marching together and taking out teeth like crazy. Caved in faces. We could go to McDonald's and we could see the people. And I said, oh, you had 4 teeth out. How do you know? I said, oh, I can tell. And the orthodontist ridiculed me. He said, you don't know what you're talking about. We are orthodontists. And I go, yes, but I treat the patient for life. You treat them 2 or 3 years, and you are not doing a good job. You're not doing a correct job.
I need a bodyguard now.
So now, I had an orthodontist almost want to punch me, and I told him, he's a young guy out of school. I says, I know you're upset, but years down the road, you're going to see that what I'm telling you is correct, and that has actually come true because of multiple lawsuits against orthodontists that were doing that, overdoing it in cases that weren't indicated, and now they are much more conservative about taking out customs. But I was decades ahead of them because of the wise men that I studied with. So.